Good morning. It is media briefing number 46 related to COVID-19 on May 20th. I'm Bob Ravenscroft, the Vice President for Advancement. With us today is, as usual, John Woodrich, the President and Chief Executive Officer of Bryan Medical Center, and we have a guest presenter from our pharmacy, Kevin Sponsel. We've been waiting and waiting to bring this topic to you because there have been multiple questions regarding Remdesivir, but the timing wasn't right to do that for a variety of reasons. I'm pleased to report we now can, and I know you'll be as impressed with Kevin as I am. Just a really quick story of why I'm so impressed with these folks. In the early 1980s, when I left for college to the University of Iowa, I had aspirations of being a physician or a physical therapist, something clinical. A lot of kids that go to Iowa do because of the rich heritage of University of Iowa hospitals and clinics at the flagship university on that side of the Missouri River. But there's a weed-out course called Chemistry 413 for all pre-med, pre-pharmacy, nursing students, and it was really hard, and frankly, it weeded me out. It's one of the reasons I have such high regard for Kevin and the team in the pharmacy. They're so intelligent, disciplined, organized, and caring, and it's truly a privilege to work alongside of that entire team. So after John, Kevin will come up. He's representing one of our 55 PharmDs, which is a doctor of pharmacy that we have here at Bryan. And there's been a 6-member team contributing to our clinical response to COVID-19. You know, this many PharmDs at Bryan is really a behind-the-scenes distinguishing factor at Bryan Medical Center that serves all physicians and patients who deliver or receive care here. A little bit about Kevin. He earned his PharmD at Mercer University after completing his undergraduate work at the University of Missouri. He then completed 2 postdoctoral residencies, the first at Emory University, pretty heady company there, and a second residency for infectious disease at St. Francis in Indianapolis. In addition to infectious disease, Kevin also has a background in critical care. He co-chairs, along with Dr. Nora, who you've seen present here in the past, to serve as leads on Bryan's antimicrobial stewardship program, which provides leadership in the optimal use of antibiotics and the overall management of infectious disease. In recent months, Kevin has led the development of numerous treatment guidelines, reference documents, and educational material to support our providers in their treatment of COVID-19 patients and ensuring that our patient treatments here at Bryan are based on the best available evidence that we have. After John, Kevin's going to come up and he'll address things for the media for you on Facebook and those following on YouTube, and then we'll open it up for questions. So real quickly, our midnight census last night was 423. At Bryan, we have now administered 7,794 COVID-19 tests. Our positives are sitting at 1,025, and we have 36 test results still pending. So here's John, and then Kevin.
Thanks, Bob. And as you heard, we're having some good success with our third-party lab now on turnaround, so we're very, very pleased with that. Did want to share with you, we have 24 COVID positive patients in-house, 13 from Lancaster County, 11 from outside of the county. We have no patients pending COVID results in-house. Still have 10 individuals on ventilators, 5 from Lancaster County, 5 from outside of Lancaster County. 10 of those individuals are in the intensive care unit, 5 are in our progressive care unit, and 9 are in our general care unit. And you heard Bob give our midnight census, so we're pretty steady at that 423, 425 mark. So that's after opening up our elective surgeries to that second stage. Still feeling very comfortable with handling the volumes in regards to PPE and being able to service those individuals that have been waiting for a period of time to have those surgeries done. The other update I'll give you is our mobile unit. We are looking at another potential site to do it for our cultural centers, and we believe that that could happen probably this weekend, but we'll give you more information as that comes available. With that, I'm going to turn it over to Kevin.
Hi there.
So my name's Kevin Sponsel, so I'm the infectious disease pharmacist here at Bryan. So we're here to talk a little bit about Remdesivir. So as you may have heard, Remdesivir is a nucleotide, or depending on who you talk to, nucleoside analog that inhibits SARS-CoV-2, the virus that causes COVID-19's RNA polymerase, and essentially stops the replication. On May 1st, the FDA gave emergency use authorization to Remdesivir on the basis of a NIH randomized controlled placebo trial, in which showed a reduction in symptoms by about 4 days, from 15 to 11. We received our allocation in Bryan, part of what's been dispersed and donated from Gilead to the federal government, and then throughout Nebraska and the other states. We received 30 vials as of May 15th, and that's approximately enough to treat 5 courses for 5 days. So we have started those in several patients and are continue to monitor them for improvement. Yes, so each 5-day course is going to be 6 vials or 6 doses of the drug. So 5 individual patients is what we've treated so far. It's administered intravenously or IV through one of the veins. The first day is 2 doses, or 1 dose, but 200 milligrams, followed by 100 milligrams daily on days 2 through 5. It's still a little too early to tell, based on most of them have not completed their course yet. There's still a couple days left, but we're optimistic. There's some use criteria based on patients. So the FDA approved it for use in hospitalized patients with severe manifestations of COVID-19. And so we're using the criteria from that EUA to help guide decision making for us here as well. We've received a second allocation. We don't know the exact vial count yet. We're still waiting on it to be physically dispersed, but we do know that the allocation's been released statewide, and so we do expect another allocation. Hopefully more than the 5 doses, but we won't know a final count until it actually gets here on site. It's not a clinical trial. It's something called a emergency use authorization for Remdesivir. And that's when a drug does not have the overwhelming glut of data and clinical benefit to prove that it's safe and efficacious. And so in a situation like this where we don't have any other treatment options, the FDA will sometimes grant emergency use authorization. So we're using it under similar conditions that you might conduct a clinical trial. So we're obtaining informed consent. We provide information to the patients, their POA or next of kin, and then we track some data as part of the process through the FDA requirements, but we're not actually studying an outcome compared to no intervention or anything like that. And the convalescent plasma is being used under similar auspices, so it's also in the language gets a little different, but it's the emergency access program, and it's very similar. So we consent patients, we ask them if they'd like to be enrolled. We tell them, where the data is, that there's risks and benefits, but it's unproven. And then we administer, and then we collect some data. And so it's, again, similar to how you might do a clinical trial in terms of getting consent and gathering data, but we're not actually performing any scientific analysis at the end of it. So not to say that we're not evaluating some of the data later, but that's why we're capturing it. But it's not technically a clinical trial.